Greevashoola is a complex terminology, a umbrella of various complex etiological disease entities comprising of almost all the neck disorders, orthopedic, soft tissue disorders, spondylitis, spondylosis, listhesis, and 30% of the population are being suffering with this, and 70% of the population are having neck disorders. And neck pain, if it is related to it, it is soft tissue disorders like muscle, ligament, tendon, vessels and nerves, and bones and joint disorders. Yes, it is for your information. And to explain about the neck disorders, everybody will think it is a simple thing, but it is a global burden. The data available from the USA is 87.6 billion global burden on this disease. Indian data is not available. Yes, all the neck disorders, if we can rotate 360 degrees, probably we don't have any problem, because all can rotate 360 degrees, because multiple discs, more than we have 7 cervical spines, but it will have more than 12 cervical spines protecting the cerebral arteries, vessels. It will have a special mechanism to protect, and probably it doesn't have any problem in rotating, but we do have so many problems. Well, classification of the neck. One is axial neck pain. This is purely related to the musculoskeletal, and radiculopathy is referral pains, and then myelopathy is which causes caudal compression. Myelopathy refers to pressure on the spinal cord, also referred to the spinal cord compression. Well, there are 2 factors responsible for this, and one is biological factor and another one is psychological factor. Biologically, we can elicit neuromuscular disorders, autoimmune disorders, genetic, gender, age-wise, and when psychological factors also have a say in this, even stress, anxiety, cognitive variables, sleep problems, social support, personality, even behavioral problems will also have a say in the neck disorders. Ayurveda says, Deham Vyapnoti Sarvantu Vyanam Shigragati Pranam, and the main Vyana Vayu is responsible, and this is going to cause the most of the cervical problems, neck disorders, and Samanya Samprapti. When you see these Vidyahara Viharas, provocation of Vyanavata and Sthana Samshraya in Amsa Pradesha, and there is a Sleshpaka Kapha Shosha and affliction of Sira, Snayu, Mamsa, Asti Kandaras. There is, and which results with the Bahu Chesta Hara, Upper Bahuka results with the so many deformities of the upper limb deformities. And when to involve the doshas, especially Vyanavata in the Chalagunata Kshaya, and Pranavata is responsible with the Karmata Kshaya, and Sleshmaka Kapha is responsible with the Dravyata Kshaya, and Avalambaka that supports the Srotas of Kapha by virtue of Ambu Karmas. And this is very important for the PG students and the practitioners, especially students. When you want to elicit the neck X-ray, this is, you have to go for AP X-ray, lateral X-ray, and swimmer's X-ray, and odontoid process X-ray. This is unlike AP and lateral view. We need a swimmer's view. Swimmer's view is especially to focus on the C7 cervical vertebra. This is like swimmer's position like this, so that this X-ray process will give a clear view of C7, and odontoid process of X-ray is very important. AP view, opening the mouth. This is very important. This clearly gives the way of cervical 2 and 3. These are very important to give a exposure of cervical spines. Well, to see the normal cervical spine, you have to see all the cervical 7, you have to count the space in between the vertebral space, you have to count the C1 to C7, and articular facets, articular surfaces, bodies of vertebra and intervertebral discs you have to see, and there wise you can, whether it is a case of listhesis and other problems, very significant problems involved. We will have a discussion, I will show you. And this is advanced cervical spine spondylosis, and you can see there is a 3 and 4, there is a collapse of cervical spine and multiple degenerations you can see, and cervical spondylosis with scoliotic spine. This is scoliotic, is a displacement of the cervical spine along with the diminished joint space, and you can see the multiple degenerations, especially on the 4th and 5th lumbar spine, you can make it out. This is very important. Once the diminution of the joint space, multiple degenerations, and definitely it will have caudal compression. Probably there will be caudal compression, which will have spinal cord compression. I will show you, these are the X-rays of lateral view. Immediately, if you see the MRI view, you can see a spinal cord compression. This is for a radiological simple X-ray of lateral and AP view. When you compare to the MRI, X-rays doesn't reveal these spinal cord compressions, and the assessment of the spinal cord compression, which leads for the immobility and neurological phenomena. These are the things to be assessed. And another thing is cervical spondylosis with arthritis of the neck. This is especially the 4th and 3rd and 4th cervical spine, you can see there is a facet joint arthropathy. This has to be, usually when we see, we only see the joint space. We see the degeneration, multiple joint degenerative changes, but facet changes, the space which is diminished in between the facet, and those things are to be assessed here. And this is the degenerative hypertrophy of the facets regarding. And my dear friends, I don't want to discuss on how Apabahuka is comparable to the frozen shoulder as per the classical description. And Vishwachi is comparable to the brachial neuralgia. Again, I don't want to teach what exactly, how it is. The symptomatology is absolutely comparable to the brachial neuralgia. And Manyastamba is comparable to the stiffness of the neck, cervical spondylosis. And Ekangavata is comparable to the shoulder referral pain. And Amsha Shosha is comparable to the muscular dystrophy. Dystrophy is a complication of spinal cord pressure, diminishes the circulation, and finally which results with the dystrophy of the joint. Very dangerous thing. The early diagnosis is a mandatory for this. Well, this as an outlook, as a general practitioner, we will think of cervical spondylosis, spondylitis, listhesis, degeneration, facet changes. But there are the things to be ruled out, like you should be very, very cautious in dealing with the neck. Especially Ayurvedic physicians should be cautious and aware of thoracic outlet syndrome. Very dangerous, and immediately there may be chance of you may lose the limb. Especially you will find in the case of drillers, especially hard-working weightlifters, you will find this thoracic outlet syndrome, where there will be compression of the clavicle and the first rib. There will be compression, especially drillers. We have seen a good number of patients. There will be compression of the vascular structure, and diminution of the circulation leads for the worst complications. And brachial plexopathy is one of the another complication, where is the brachial neuralgia, total dragging of the hind, maybe in the diabetics, maybe in the hard workers, maybe in the any compression, spondylotic degenerative changes, which could finally result with the brachial plexopathy. And myositis, and probably all youngsters might be aware of Samantha's disease. This is an autoimmune disorder which will be in coordination between the muscles, very dangerous. Only steroids are the treatment. Probably Ayurveda has a solution for this. And adhesive capsulitis, one of the important disease. This is nothing but frozen shoulder. Frozen shoulder, probably Agni Karma would give excellent results in the frozen shoulder, and Marma Chikicha instantly relieves the symptomatology of the adhesive capsulitis or frozen shoulder disorders. And carpal tunnel syndrome is one of the very important. Patient will come with the severe wrist pain, referral pain, neck pain, and this is nothing but median nerve entrapment of the thing. My dear friends and especially practitioners, if you can do it, identify the median nerve entrapment on the wrist joint, because it will be entrapped with the fibrous fascia. If you can do Bindu Pada Agni Karma on the lesion, exactly on the site, 1 or 2 applications, you can instantly relieve the patient, the steroidal injection. And the surgery to relieve the septum is one of the major surgery done by the neurosurgeons, but instantly you can give a relief to your patient with simple Agni Karma. This is a cubital tunnel syndrome. This is entrapment of the ulnar nerve syndrome. This is very easily you can identify. You cannot flex. There will be severe pain, tenderness all around the cubital fossa. Identify, and MRI will give you the diagnosis, and go for Agni Karma along with the Abhyangana and routine regular treatments, whatever you want to follow. But Agni Karma and Marma Chikicha on the cubital ani and in cubital fossa marmas, if you can handle, this will give good results in this. And multiple sclerosis, this is one of the condition where the myelin sheath will be deteriorated. The signaling vyavastha will be disrupted due to this, and there will be incoordination between the motor and sensory. Yes, we speak cervical spine disorders, neck disorders are very simple. If you are missing, there is the tubercular spine, cervical spine. The diagnosis, you can see the picture, there are changes, lysis changes in the 2 vertebrae. These things, a simple X-ray, lateral view will give a clue, and if you are missing, you will be missing everything, and system, total Ayurveda system will be blamed. There will be lytic lesion in the body of the vertebra, in the 2 bodies, and once please try to refer for the ATT, you need not wait for that. And this is cervical spondylitic myelopathy disorders, and this is you can get a Greevashoola, probably would give good results in the myelopathy disorder. Whenever you have a problem which are not responding regularly with the treatment, then you have to go for the MRI treatment, MRI evaluation, that will signify. This is very important, sending your patient for the evaluation. This is, you can see the compression, caudal compression at the 2nd and 3rd cervical spine. And cervical spondylitis with abscess. You can see the abscess formation, and one of the vertebra, there is a total lysis in the 4th cervical spine, and there will be retropharynx, there will be a big abscess area you can see. Looks cervical neck disorder, but missing abscess in the cervical spine and the pharyngeal region, there is a black area. If you miss that, you will be missing everything. This is abscess, the causative factor, infective criteria has to be ruled out. And cervical pain instability in rheumatoid arthritis, because most of the disorders are still associated with the rheumatoid degenerative changes. Rheumatoid degenerative changes can be elicited through the X-ray with the earlier stage of facet degenerations rather than intervertebral degenerations. Yes, neck disorders are as simple as, but there is also life-threatening neck disorder. Atlantoaxial vertebra, by virtue of your negligence or inability in the diagnosis, if you leave the patient like that, sudden collapse of atlantoaxial vertebra, sudden neurological death may occur. That is the reason when you get a patient appropriately, you have to evaluate with simple X-ray initially. That will give atlantoaxial first and second cervical vertebral changes, and there are gross changes at that particular place, and if there is any lytic lesions, immediately you should be cautious, you should aware, you should support your patient in giving the clue. And treatment modalities, there are physical therapies, medical management, surgical management, manual therapy, because now if it has become a complex, you have to refer to a ortho, and if there is a vascular surgeon, general surgeon, orthopedic surgeon, and so many multiple specialties are there, but be careful in this. And treatment of Vata Vyadhi is very simple to speak, and Abhyangana, Sneha Svedas, and these are the modifications we see in the Sneha Svedas, probably. Yes, how they have impact on the possible Ayurvedic treatment. Simple, everybody thinks that Abhyanganam, Pendasvedam, Grivavasti, how they will have impact, strengthens the lower back muscles, increases the blood supply of lumbar muscles or neck muscles, restores the flexibility, stimulates the nerves, relieves the pain and numbness, reduces the soreness, alleviates the pain associated with fracture and dislocation. These are the things how they work, and probably I don't want to go how it works. Grivavasti, possibly we regularly practice. This is Nadi Svedam, wonderful treatment, instant relief. And one of the successful stories I would like to give you, Mr. Ravi, 49 years, from Kadapa patient, who was operated twice very recently, and 2015 and 18, operated laminectomy 2 times failure. He has come to me with the same limb weakness. There is a scoliotic changes. He has come to the treatment. We have done regular Abhyanganam, Grivavasti, and followed by the Marma Chikitsa, because I am a surgeon, regularly practices Marma Chikitsa. The total numbness, weakness, and he is relieved within few months of time. He is already, I will show you some of the pictures of this. And post-laminectomy status, you can see the total laminas were removed. Twice it was operated. Wonderful. I don't know, you cannot ask me how it worked, the Abhyanganam, Grivavasti, how it worked, Marma Chikitsa, how it worked. There are no laminas. That is the thing we have to sing. Not only there is a supportive musculature, adjacent musculature, if you can strengthen up, probably it will work like a supporting pillars. And another patient, successful clinical story, Mrs. Sumati, had few months of allopathic treatment, physiotherapy, and she has come with undergone Abhyanganam, Grivavasti, and we have done the Agni Karma. I will show you the pictures. You can see that there is a caudal compression at cervical 2, 3, 3 and 4, and which was relieved within a few weeks of time. And cervical degenerative spondylosis, this is another case. There is a mild scoliotic changes, interfacet degenerations, you can make it out. And with my experience, because I am talking on behalf of the Dhootapapeshwar, it happened accidentally. I don't know how my name was taken for that. I am very much thankful. 5 commandments I would like to say for especially young practitioners, students and PG students. Cervical spondylitis, manageable with Abhyangana and Nadi Svedam. Nothing to worry, you can easily manage. And cervical spondylosis, manageable with Abhyangana, Nadi Sveda, Grivavasti. It has a wonderful impact. And cervical spondylosis with brachial neuralgia, Abhyangana, Nadi Svedam, Grivavasti, and adopt Agni Karma judiciously on the patient, selectively. Probably which would be very useful, followed by Marma Chikitsa if necessary. Any one of the thing you can select. And cervical spondylosis with caudal compression, spinal cord compressions you can see, and probably Grivavasti, Basti Chikitsas, Agni Karma procedures, and Marma Chikitsa. Because I cannot elaborate, this is a topic which was given for me 15 minutes. And another one is spondylolisthesis with caudal compression, Grivavasti, Agni Karma procedure or Marma Chikitsas would give instant and very, very good. Confidently you can practice. And finally, Satatadhyanam, Vadam, Paratantra Avalokam, Tadvid Achara Sevecha, Buddhi Meda Karo Smriti. and don't be panic and don't be hurry, and if they are responding, it's okay. If they are not responding, review the case, retrospect the case, and refer to the nearest physician or surgeon or anybody who is a high calibered man, and don't hesitate to refer, because there are death causing problems and major other problems involved. When your patient is responding properly, it's okay, but when there are ample chances for infective disorders, death causing disorders and limb disruption disorders, you have to properly refer, review, retrospect and refer. This is very important in the practice. Be the change you want to see in the world, and I'm really thankful, and being again with my colleagues of Ayurvedic College, I'm very much thankful. Hopefully I'm within the time. Thank you one and all.